You hear a rheumatologist talking to Ms. Walker. You have 30 seconds to go through the notes. Good afternoon, Ms. Walker. Lovely to see you again. How have things been since we last spoke?
Afternoon, doctor. Well, it's been a bit of a mixed bag, to be honest. Some days I feel like I'm managing all right, other days I wake up and it's like my hands have turned to bricks overnight. Stiff as anything, takes me ages to get dressed in the morning.
That sounds frustrating. Is it mainly your hands, or other joints giving you bother too?
Hands and wrists are the worst, especially first thing. But I've had a few flare-ups in my knees again recently, like sharp, hot pain that makes going upstairs feel like climbing Everest. Ankles swell up too if I'm on my feet too long. I've started avoiding long walks, which is a shame cause I used to love getting out in the woods with the dog.
When did the flares start getting more frequent?
Around February, I think. I'd been doing all right on the methotrexate for a while, been on that since early 2021, but lately it's like it's lost its punch. I take 15 milligrams once a week, along with folic acid, and I do the injections myself. But recently the fatigue's crept back in, and my joints are more temperamental again.
And have you been tolerating the methotrexate okay?
Mostly. I get a bit queasy the day after I take it, sometimes feel wiped out, like I've been hit by a bus. But no major side effects otherwise. I had a bit of a scare with my liver function last year, but that settled down after we adjusted the dose. Oh, and I also take naproxen when the pain gets bad, with lansoprazole for the tummy, can't be without that, otherwise I get awful indigestion.
And how's your mobility overall? Are you still working?
I am only part-time now though. Used to work full-time as a teaching assistant, but couldn't keep up with the pace anymore. I get stiff if I sit too long, but I also seize up if I'm on my feet for hours. Bit of a no-win, really. My boss has been understanding, but I know I'm not firing on all cylinders.
Understood. So it sounds like the methotrexate isn't quite doing the job anymore. We might need to look at tweaking your treatment plan. Have you thought about stepping up to a biologic or a JAK inhibitor?
Yeah. My GP mentioned it when I saw her a few weeks back. She said it might be worth trying something new since I'm still having flares. I've done a bit of reading, there's that adalimumab one, and baricitinib, I think it's called. But I've no idea which is best or what the side effects are like.
You're spot on, both are options. Adalimumab is a biologic that's injected every 2 weeks, while baricitinib's a daily tablet. They work differently but both aim to bring inflammation down and give you better control. We'd run some bloods and screen you for infections first. There's a slightly higher risk of things like shingles or mild infections, but most people manage just fine with monitoring.
Right. To be honest, if it means I can get back to walking the dog without feeling like my knees are made of glass, I'm open to it. I don't want to keep living like I'm twice my age, I'm only 44. But it feels like 84 on bad days.
That's totally fair, Claire. Let's get those screening tests done today, and I'll go through the pros and cons of each option with you in detail. We'll also keep an eye on bone health long-term and check your vitamin D and calcium levels.
Sounds good. I just want a plan, really. It helps to feel like we're actually doing something about it, you know?
Absolutely. You're not stuck. We've got options, and we'll tailor things to suit you. Let's get things moving. End of extract 1.